More people are becoming unpaid caregivers for their loved ones. In fact, 1 in 5 Americans are now taking care of family members. In tonight's Making Ends Meet, Michelle Lee reports they could be leaving life-changing money on the table simply because they don't know where to get help.
More Americans are taking care of their loved ones than ever before as turnover in home care hits an all-time high.
So in home care, we see about a 64% turnover annually for direct care.
Yikes!
It's worse in skilled nursing.
And as healthcare costs continue to soar.
It's a crisis.
It's something Sarah Lovegreen worries about at the Alzheimer's Association of Greater Missouri. Here, it's not just about fighting disease, it's also about supporting families.
So we see with dementia caregivers, they're more likely to have poor physical health compared to non-dementia caregivers. They have higher rates of depression, higher rates of anxiety, so it's very taxing on the family.
Figuring out what resources are out there for you is incredibly important.
One resource for dementia patients in Missouri is the Structured Family Caregiver Act. It gives families some payment for caregiving, connects them to a home care agency or provider, and even gives families technical support. There are Medicaid requirements that can be challenging, but a big problem is that not enough people know the pilot program even exists.
There's only 300 slots available right now because they are running it as a pilot program. We have not maxed it out, I can tell you that.
The AARP says 48 million Americans take care of loved ones without any pay, even though many have to quit their jobs and still work 24 hours or more a week for their loved ones. In Missouri, there are thousands of people who could use some help.
Our main concern was those 18,000 caregivers who don't have any sort of health insurance, and would be eligible for Medicaid.
As families struggle how to make ends meet and take care of their aging families, experts say take some time to find out which resources could help take off some of the weight. You don't have to do it alone.
We're here to help navigate that for families so that they can really ease the burden as much as possible.
Michelle Lee, 5 on your side.
There are still a lot of nuances that families have to navigate to get the help, but bottom line, you should know there is likely a program that can help you get some payment to be a family caregiver. It's something the state and national groups on aging are keenly aware of as more people are living longer and need assistance.